Um,
Let me compose myself.
mhm.
And I'll just start at greetings. I'm Benjamin Zappin. I am CEO and co-founder of Five Flavors Herbs. We're really excited to welcome our old friend, Dr. Jessica Parker, today to share her expertise and experience about hormone cycle mapping. Um, Jessica and her practice have been we've been following each other from Santa Cruz to the East Bay and Oakland and now to the Nevada City area. It's a common circuit, and it's really fun to be in professional community with Jessica in all these places. Jessica is doing cohorts of education geared towards functional medicine for your acupuncture practice, and has a cohort starting in the fall that we want you to take a look at, get an opportunity to get a sampling of her expertise. And one of the really great things is Jessica will be sharing about the intersection of hormone cycle mapping, a form of functional medicine, and its use in conjunction with proline, formerly known as conceivable proline. Um, so, without further ado, we welcome Dr. Jessica Parker and really appreciate you joining us and look forward to hearing your expertise. And this is part one of two, so stay tuned.
Awesome. Thanks, Ben. Absolutely always great to be able to share through Five Flavors and be a part of this community. Five Flavors Herbs has been a big part of my practice for over 15 years now. Again, welcome, Hormone Cycle Mapping. This is part one. So today we're going to look at the menstrual cycle in terms of phases and talk about how to use those Proline formulas according to your patient's cycle. I used to rely heavily on those 1 day hormone tests that are either from saliva or urine. And those tests just always really frustrated me because they're a shot in the dark, right? Trying to understand an entire cycle by testing on just 1 day was really just not enough information, right? As acupuncturists, we want the whole picture. We want to see how all those organ systems are working together. So looking at a complete cycle and beyond is really the best way to get that accurate data for treatment. I also love all the tools out there. There's all these doohickeys to track the ebbs and the flows of the cycle. I think that we have a really cool opportunity now to see that dysregulation, those patterns in real time when we're really mapping out hormone results and looking at an entire month and beyond. Um, and then when you combine cycle mapping with functional blood chemistry tests, you're looking at the thyroid, metabolic markers, nutrient status. You really are getting even more of an in-depth picture at what's driving the imbalance. So today in part one, we'll cover the phases of the seasons, the menstrual cycle formulas associated with the proline that are associated with each phase. So next month, I'll be sharing actual hormone cycle mapping results from my patients. We'll look at some case studies that show how I've used the Proline specifically in my clinic. So just a little bit about me. I've been practicing as an acupuncturist for over 15 years. I incorporated functional medicine when I received, around the time I received my doctorate in 2016. And then during my training, I've had the opportunity to work in integrative hospital settings, both here in the US and in China. And those experiences really showed me firsthand how powerful it is when we bring together different healing traditions. So those experiences at both hospitals shaped my entire approach to my practice. And what I discovered is that when we combine the wisdom of East Asian medicine with more modern functional lab testing, something really special happens. We're not choosing between Eastern and Western medicine. We're really creating something that's stronger by using both. So while Eastern medicine, acupuncture are, these 3,000-year-old plus approaches that treat the body as interconnected systems working together. Meanwhile, functional medicine is using lab work, even from a simple blood draw, to really see what the root cause of dysfunction is, how to optimize the body. And what I love is really when you read labs through that East Asian medicine lens, everything clicks into place. You see blood deficiency that can show up as low ferritin, low B12. You can see spleen chi deficiency really reflecting in how the body is processing protein, for instance. You can see liver chi stagnation and maybe some how it might manifest in insulin markers. So, this all kind of brings it together with that pulse and tongue diagnosis, and it really validates this. It creates tangible data for your patients to see and look at. And I feel like treatment just becomes really precise. So I've used these functional labs in my practice every single day now. I honestly can't imagine doing it without this anymore. And it's really transformed how I treat more complex cases with hormonal cases, fertility challenges, chronic health, autoimmune, and all of that. And so now teaching other acupuncturists to integrate labs into their practice has just become a huge passion of mine. And I really love combining that cycle mapping, the tracking the hormone metabolites, whether it's urine metabolites or BBT charting. We'll talk a little bit more about those with the functional blood chemistry panels. You just get the whole picture. It's really great for your patients. So again, that's what today's session is about, exploring the cycle mapping, the phase-based herbal prescribing work, and how it works together. Okay, so cycle mapping, again, that gives us this complete picture rather than just those one-off tests. We're looking at what's happening all together hormonally so that we can really kind of get more precise with our treatment. And so we'll break down hormone patterns across the menstrual cycle, what's happening with each phase, and then start to touch on those herbal-based formulas to support the optimal balance. Okay, so just to get started today, we're looking at something that hopefully many of you are familiar with, kind of taking us back to this overview of the menstrual cycle. Um, I think that it's really important to know well because it wasn't until I was well past college before my male roommate explained to me the menstrual cycle and really explained to me what was going on hormonally. I really didn't even know, I didn't know how ovulation worked. And I genuinely thought that you just release eggs all the time. You're just releasing eggs throughout the entire month. So I have humbly spent the rest of my life and career really absorbing the complexity of the menstrual cycle. Many of you may be really familiar with this, which is great. And we'll look at another slide next that kind of takes us to the next level with more of the concepts of Eastern medicine and how it views the cycle as a series of seasonal changes. So for now, we're kind of looking at the basics here. You can see the bleeding phase in this earlier part of the cycle, the beginning of the follicular phase here. We're seeing changes in actual hormones. This is kind of what the metabolites look like in a urine-based cycle mapping test. And then you have the BBT chart. So that's what you're looking for with that, the temperature charting. Different secretions that are happening here, changes in cervical position, the way that the follicle changes into that nice corpus luteum here, and the endometrium lining changes here. And again, each of these are associated with different phases of the seasons. So this is one of my favorite slides. I did not make it. I have to give all the credit to a past student of mine. I actually was teaching TCM gynecology at ACCHS, and Margaret Zhao is a recent grad and came in to do also a talk for the class. And they are a fertility awareness educator. They had this awesome presentation about BBT charting and this beautiful slide. And I'm so grateful that Margaret lets me use it. I've used it in so many different talks because it's so spot on. And this is just an excellent representation of the microcosm in the macrocosm, right? How we can see how each phase of our cycle is related to a season. So these phases, as the inner seasons, they really they're bringing their own energy, their own opportunities here. So we're starting from the bottom left here in the blood phase. This is the inner winter. And this is when hormones and metabolic activity are at their lowest, right? Your body and your mind are naturally purging, you're shedding. This makes it an ideal time for more intuitive insight, clarity, introspection, time to like rest and bleed on it. Just sort of letting things go, nourishing your blood with warming soups, stews, ginger, dongui, peony root. Keep movement really gentle during this phase. Now we're moving up to the upper left where we see that follicular phase, the inner spring, the yin phase. The LH and the FSH, they are starting to stimulate new egg follicles. We'll talk more about those in a few slides here, which help release estrogen, this real intense yin fluid, right? Yin hormone. So you'll notice a proliferation of new cells, new cervical fluid. This is when metabolic activity is starting to increase. Creativity, expression, this is all connection kind of naturally flourishes around this time. This is a good time to work towards goals, try something new, nourishing your yin with warming, nutrient dense foods, moderate exercise feels really great here. Now we move into that yang, that ovulation time. This is like inner summer. This is that peak of fertility hormones, the peak of cervical fluid and metabolism. And that follicle is releasing the egg, it's releasing egg cells that then becomes the corpus luteum, that the body temperature will rise at this point. And this is when you should honor that excitement, that desire, pleasure, calling, strengthen your yang, eat the rainbow. You generally handle more moderate, intense exercise during this time, and this is at its peak phase, right? Then finally, now we're moving down into the luteal phase, that inner autumn. This is that chi phase at the bottom right here. So growth, regeneration, slowing down as that corpus luteum is releasing that progesterone. The inner lining of the uterus starts to get more plushy here. It's a good time for organization, productivity, setting boundaries, kind of tying up loose ends, right? It's the harvest time, getting prepped for the next winter. Supporting your chi, fluid circulation, lymph circulation, exercise can range from more moderate to gentle movement depending on how you feel. And again, understanding all of these inner seasons really allows us to kind of align more with that natural rhythm rather than fight against it. Okay, so cycle if and while you can. So before we kind of dive into the cast of characters of our hormones and then into the proline, I want to talk about something I feel like is discussed not enough. And your menstrual cycle is not just for making babies. So the menstrual cycle is about building health. And it's the fifth vital sign, right? And this is for good reason because regular ovulation throughout the reproductive years brings significant health benefits. And sorry, I just was making sure I'm not missing anything, but that regular ovulation is just so beneficial for your body. And that's what we are as practitioners here to do, right? We can help our patients really make sure that their cycle is functioning correctly. And I really love the hormone repair manual. I wanted to make sure that I quote in this because Dr. Laura Brighton writes the hormone repair manual. It's awesome book, really tangible, super easy to read. It's all about perimenopause. And there's a chapter called Cycle While You Can, Ovulation Builds Health. I really loved that concept. I love what she writes in there, and I've sort of adapted it to cycle if and while you can. And again, this is where Eastern medicine just really is so awesome and we help our patients regulate their cycle. My specialty is in hormone support. I joke all the time if someone comes into my clinic with ankle pain, I refer out. I don't know what to do, but if someone comes in, they haven't had a period in 6 months, I'm like, yes, this is my jam. I'm on it. So if you can keep your patients really cycling naturally, you are doing so much more than just help them get pregnant, right? You are helping them build long-term health. And why this matters, again, studies show that natural cycles are associated with reduced long-term risk of heart disease, reduced long-term risk of dementia, longer, healthier lifespans, increased bone mass. That natural rhythm of estrogen and progesterone during each cycle provides these cumulative health benefits over time. And actually, Dr. Bryden uses the analogy, which I really love, that every cycle is like putting money into into a savings account to spend on retirement. So our medicine, again, it really shines in this area. We're here to help our patients get their cycles really regular and back on track. And one important distinction here is the birth control pill is not a substitute, right? Birth control pills do not provide these health benefits. In fact, that synthetic progestin can cause high blood pressure, hair loss, anxiety, depression, and an increased risk in breast cancer. So the birth control for birth control, I'm supportive of that, but the birth control for cycle regulation is just really not ideal. And the reason why I bring this up, I'm sure you've probably heard about the changes and the kind of controversy over HRTs. There was a flawed 2002 study that really led to decades of fear, misinformation about HRTs, and for years OBs weren't they had stopped prescribing HRTs and instead would put a lot of people on the birth control pill to regulate their cycles, especially during perimenopause, which is a really critical time to really support natural cycling. So thankfully that's changed. There's been a recent reevaluation of that study showing that those HRTs, the benefits far outweigh the risks, and especially when they're used appropriately. So now I'm seeing a lot of my OB colleagues, they're prescribing estrogen patches, bioidentical progesterone, much better options than that birth control pill to help regulate the cycle. And our job as practitioners is to take it another step to do that with herbs, right? And we can support those natural cycle regulations for our patients, helping them build health with every ovulation cycle. We're helping them put their money in that savings account, right, for their future. And then just my feeling for a lot of my patients, they ask me, like, what do I do for birth control when I'm in perimenopause? My feeling is the best birth control in perimenopause is a vasectomy. Okay, let's talk about the queen here, estrogen. So estradiol is the primary form of estrogen. It's made on the way to ovulation in that spring phase. Um, Estrogen has numerous important functions in the body. It helps build muscle and bone. It maintains brain and heart health. It helps regulate cholesterol levels. It works with progesterone to balance out, provides metabolic benefits. It helps with preventing insulin resistance. It assists with the ability to lose belly fat. It strengthens muscles, boosts motivation, helps with physical activity. And that it also thickens the lining of the uterus, right? We saw in that initial picture. This is why during perimenopause, sometimes those periods become heavier because of the ups and downs of estrogen. It also increases breast tissue, which is also, oh, and fibroids can be an issue during menopause, also for that same reason, from the thickening of the lining. So the three main types of estrogen, we have estradiol, that's the most potent form during our reproductive years. Estrone becomes more predominant during menopause. And then estriol is a gentler estrogen that increases during pregnancy. So estradiol begins to fluctuate between your 30s and 50s, and eventually leading to a loss of that estradiol, where esterone, those levels become again dominant in menopause. So we don't completely lose estrogen into menopause, but we do lose that estradiol. Detoxification here is really key, making sure your patients are moving their bowels regularly. This helps with supporting any sort of transitions that's happening with estrogen and really making sure that elimination is clearing excess estrogens through the body. That's a big one. Okay, now we're meeting sister progesterone. This is what, again, in that book, Dr. Laura Briden, highly recommend it. Great for practitioners, great for your patients. Um, and she calls it sister progesterone. I really love that because progesterone is made after ovulation during what we call that, again, in that chi phase and the more of the autumn phase is when it's more predominant. So it helps with thinning the lining of the uterus, kind of not so much thinning, but again, making it plushy for implantation. This also helps counteract those heavier periods from excess estrogen. It helps with calming the brain, increasing production of GABA, an amino acid that helps with relaxation. This also helps promote sleep, reduces anxiety, reduces inflammation. It helps form the myelin sheath. It sort of insulates those nerves. It increases the metabolic rate, and it has this really cool Wei Qi aspect where it supports the immune system by thickening the cervical mucus. So it helps protect the body here. And it also helps with building bones. So, one important thing to note, many women, and we'll talk about that when we're looking at some of the Proline formulas, many women do experience that PMS because of the dramatic drop in progesterone, when it really should be more of a slow cascade right before bleeding occurs. And then once in menopause, you actually do stop making progesterone altogether, unlike with estrogen. All right, here we're talking about FSH, and I chose this like gentle rising moon because it kind of has more of this, it's this subtle yang action, but it's quietly stimulating yin and estrogen production here. So, in contrast to its partner, we'll talk about next, luteinizing hormone, which is far more yang in nature. FSH is just a little more gentle throughout the cycle when you're looking at the metabolites cycle mapping tests. And so FSH does exactly what its name suggests. It stimulates that follicle growth in the ovaries. It helps develop the eggs inside them. It prompts that estrogen production during that first half of the cycle. It's essential for puberty, for sexual maturation in all people. And this is why we also test FSH when we're in perimenopause into menopause to sort of see where someone might be in that transition. And tracking that over several months, if not longer, can kind of give us the general picture of what's happening with FSH into the perimenopausal transition. So both FSH and LH are produced in the pituitary gland, and they respond to signals from that hypothalamus. So for our highly stressed out patients that are chronically overstimulating the hypothalamus, this will disrupt this whole orchestra of hormones. And cycle mapping is a really cool tool to use for your patients to really see exactly how stress might be affecting someone's hormone patterns. And you can see that in real time. Okay, luteinizing hormone, or LH, again, it's famous for that triggering ovulation. It's a critical moment right around mid-cycle in that summertime when a mature egg is released from the ovary. It's like this super yang, it spikes to help with the release. So after ovulation, LH maintains the corpus luteum, which is what produces that progesterone to prepare the uterine lining for potential pregnancy support, for implantation, or to support the body to move into the next cycle. So what's important here to understand that LH, it doesn't work alone. Again, it's really it really collaborates with FSH to regulate the entire reproductive system. They're really a team. So this LH is produced in the pituitary gland as well, released in these pulses throughout the day. So these pulses do vary on the time of day and where you are in your menstrual cycle. So that pulsing is controlled by gonadotropin releasing hormone from the hypothalamus. And again, it just shows us how these are all interconnected. They all work together. And again, also why stress is so impactful on our hormones and how it impacts our lipid metabolism, protein absorption, really all the things. Okay, so kind of the full picture here, cycle mapping plus functional blood chemistry. These are the two tools that really form the foundation of how I work with my patients. Cycle mapping tracks hormone patterns, as we've talked about, across the entire menstrual cycle. So we're not doing those one time, once a month tests on, day 21. We're really wanting to look at the full picture. You can use those at-home metabolite testing devices like Mira and Nito. Those are some that a lot of my patients use. And what I like about those is they measure the estrogen metabolites, progesterone metabolites, luteinizing hormone, FSH. I also use basal body temperature to confirm ovulation, to assess maybe other patterns that we're looking for, luteal phase inadequacy. And through that hormone metabolite testing, that's really my primary focus now because it gives me more direct hormone data rather than trying to infer a little bit more from those temperature shifts alone. We cover this in part two because there are totally pros and cons of both, and there are reasons why your patients might want to use one tracking system or over the other. But with cycle mapping, again, it's the complete hormone arc, whether you're using the metabolite tests or the BBT charting. So when estrogen rises, we're seeing ovulation occurring. What's going on? Is there a robust luteal phase? Are there times when, patterns are delayed? Ovulation is delayed, for instance. So it also gives your patients like really tangible information. They're looking at it, they're seeing their progress, and they're seeing their progress as it unfolds when you're adding in different herbs for them. Functional blood chemistry is it is basically standard blood work, but it is what I usually have my patients do. It's much beefier than just what they get at an annual. So we are looking at the blood count, complete blood count, CMP, metabolic panel, thyroid panels, iron panels, lipids, inflammatory markers, and then interpreting this through the functional ranges, which are the optimal ranges. They're more narrowed, and integrating it then with your TCM diagnosis. So this is an amazing way to catch imbalances far before disease develops. And it really validates what you're already seeing in pulse and tongue. So you can see spleen chi deficiency maybe showing up as like low protein, liver chi stagnation. As I mentioned, it could be indications from insulin resistance. We're seeing blood deficiency manifest as low ferritin, right? So your TCM diagnosis just really gains more objective confirmation. And then you can identify these root causes, which might be driving hormonal disruption. So when they work together, that cycle mapping shows you the hormone pattern, functional blood chemistry shows you the why. And again, you're combining it, you're not guessing, you're treating that foundation with the data and data that your patients can see too. And that's really confirming your diagnosis, and it helps guide with formula choice. So I really love being able to use this for my patients and teach my patients how to read their labs. And then I love teaching this to acupuncturists. All right, let's talk about the ebbs and flows of the hormones for each cycle and the formulas in the Proline that are associated with them. Another book that I just love, it's a required reading book for my cohort program. It's The Spirit of the Blood by Randine Lewis. Not only does she cover the markers in the blood draw, she's really covering them from a classical, more Taoist medicine perspective. She's a beautiful writer, and she covers these phases too. Highly, highly recommend this book. But here we are in the blood phase, also known, right? The menstrual phase. This is the represented by the new moon. It's the season of winter, that time of release, rest, renewal. So hormonally, everything should be at baseline zero. The all hormone levels generally are at their lowest point. Progesterone withdrawal is what triggers bleeding, right? And FSH slowly begins to rise in the follicular phase. So body temperature drops during this phase. From a TCM perspective, we're looking at the way the lung qi directs heart blood to descend to the baomai, to the uterus, to stimulate uterine bleeding. This is a natural, necessary release. The body is shedding what it doesn't need, helping to make space for renewal. So, our treatment goal during this phase is to support that release. We want to move blood, chi and blood, thinking about like the four gates, liver four, I'm sorry, Li4, liver three, and really just to help ensure that smooth flow, right? We want to address counterflow or any sort of chi stagnation, which may be causing painful cramping or clotting, incomplete bleeding. And so the herbal strategy here is twofold, right? We're nourishing blood and we're moving blood. We're supporting the body to release we're supporting the body to release and helping simultaneously begin to rebuild. So the Proline formula for this phase is release, which is based on Tao Hong Suo Tong. You want to use this for days 1 through 3. It's gently invigorating blood, breaking up stasis, and supporting that smooth menstruation. This really sets the foundation for that follicular phase that's coming next. Looking a little bit deeper here into release, really balanced to do a few things at once. So it helps release again that uterine lining. It's harmonizing menstruation. It's relieving pain. I love this formula for helping with painful periods, and it's also gently nourishing. It's building that blood through by supporting the liver and the kidneys. So those blood moving herbs like tauren, hong hua, those help break up stasis. They promote that smooth flow, and then you have that base formula of subutong that helps with nourishing blood and prevents depletion from the bleeding itself. So this formula again is addressing the pattern of blood stasis in the lower jiao, maybe showing up as like scanty or incomplete menstruation, irregular cycles, painful periods, no periods, missing periods, really light periods, PMS, clotted, dark menstrual blood. So by using release on those first 3 days, you're ensuring kind of a clean slate here. Complete release of what needs to go while simultaneously starting to rebuild again the foundation for the next phase of the follicular phase. So now we're moving into that phase. Follicular phase represented by the waxing moon, the season of the spring, that time of growth, building, renewal. And ideally, estrogen is rising progressively here during this phase. FSH is signaling that follicle development in the ovaries. And eventually, that one dominant follicle emerges, and that's going to be released towards at ovulation. So as estrogen climbs, patients often report like this is that time where their energy and their mood feels better. They have more mental clarity. They're feeling more vital in general, more motivated. And we'll cover sort of the when things go awry in part two, in section two next month, because not everyone experiences these perfect flows of the season. They're not feeling amazing during days 9 through 10. And we'll talk about why in the next part. But again, when we're talking about like a stable cycle, the body is visibly and functionally shifting towards ovulation. So cervical mucus might become more abundant, fertile. Basal body temperature kind of remains low as it starts to rise here. And that uterine lining is thickening to help from the support of estrogen. So, from a TCM perspective, nourishment is absolutely key here. That follicular phase needs a lot of nourishment. This is when the spleen is helping build blood after we've released it from menstruation. So, the liver stores the blood to support the building yin and preparing for that ovulation. So we want to treat and think about that Jui Yin pair, the liver and the pericardium, to encourage yin and blood building. And this is where we kind of emphasize that concept of like nourishing yourself first, right? You putting your own oxygen mask on before others. This is a time when that body needs substance, rest, and support again to build that yin foundation. So proline formulas during this phase go from days 4 to 14. And again, they're this yin building process, and we have options depending on really what the patient needs. We'll go forward on looking at all of those. Okay, so we'll start with Enrich. This is a modified Guishao Dihuangwang formula. It's like your go-to formula for deeply nourishing blood and kidney yin during that follicular phase. And with Enrich, you want to look at your cycle maps. You might see a couple of patterns happening here. So, and both of them really point to the kind of the same root deficiency. So first, maybe a sluggish or prolonged follicular phase where that estrogen isn't really rising or it's rising really slowly. Ovulation might be delayed at like day 16 to 18. Basal body temperatures here might actually stay a little low or lower than longer, I'm sorry, low longer than expected. Again, that's kind of like this sluggish push to get that estrogen going. And the second would be actually highly elevated follicular phase BBT. So the temperature's a little higher, a little warmer than it should be in that pre-ovulatory window. And this isn't a sign of too much heat, right? But it's a sign of not enough yin nourishing. We don't have that yin substance to nourish to keep those temperatures kind of where they belong. And so in Chinese medicine, Both of these, again, are kind of expressions of the same underlying pattern, which is that blood kidney yin insufficiency. They aren't strong enough to build. We can't build that follicle completely. So now you're combining other blood work. You can check for low hemoglobin, low ferritin, low B12. These are all really helpful markers to understand blood deficiency. And that may be directly impacting the body's ability to build that healthy follicle and that uterine lining. So, clinically, your patients might have scanty menstruation, short cycles, anemia, fatigue. They're just really feeling really sluggish, low back pain, sore knees, vertigo, thirst. And this is like that blood and kidney yin shoe, right? We're showing up, it's all showing up in their symptoms and in that data. So Enrich really gives them that the resources that they need to start to produce higher quality eggs and that nourishment. It starts to nourish the uterine lining. Their body is getting that nutrition. So it's especially useful for patients who are like generally depleted. Maybe they're running on empty too much, over exercising, not eating enough protein, dealing with chronic stress. Everything's just their bodies are really drained. And unlike the traditional formula here, this version, I really like this because it doesn't contain guaiban. So that's really makes it just more accessible for our patients and more appropriate for long-term use. Okay, next we have Cool. And this is based on the modified Zhibai Dihuangwan. This formula is really good for nourishing severe yin deficiency while helping clear that heat. So using Cool instead of Enrich here, again, like you're looking at your cycle map. So if you're seeing signs of yin deficiency with heat, maybe that follicular phase BBT is slightly elevated. And the patient's reporting hot flashes, night sweats, those heat signs, right? That's your cue here to use Cool. And then on the lab side, you're actually similarly looking at those enriched markers that I talked about, like maybe low ferritin, anemia, nutrient deficiencies. But again, you're also seeing some signs of inflammation or metabolic heat in their labs. Maybe elevated FSH, which could be indicating a diminished ovarian reserve. The body is like trying to work so hard to stimulate those follicles, and it's creating that false heat in the body. Low AMH could show up in their labs, more that low, poor egg quality or quantity. Other inflammatory markers like elevated CRP, a variety of inflammation markers that you can test for in a blood draw. This formula is really good for your advanced maternal age patients. Again, those maybe that are really burnt out, and again, their body's just trying to push so hard to make that follicle. People that are on ovarian stimulants for IVF, anyone with elevated FSH, again, any sort of diminished ovarian response. So, that FSH is high because the ovaries aren't responding well. This is super common, especially in the part of that wonkiness of unregulated perimenopause, right? Which it creates this heat pattern as the body's pushing harder. So brain fog is common with these patients, fatigue, low back pain, sore knees, vertigo, hot flashes, night sweats. Those are the big ones here. Anxiety, restlessness, the kidney yin shoe with heat. So Cool is really great to nourish yin deeply while clearing heat. And again, you're using this from days 4 to 14. So Regulate is based on Sunisan, one of like the most important formulas for liver qi. And so when you're using Regulate, again, look back at that cycle map, looking for erratic patterns. So the BBT, this is like for that BBT patient that has like a really up and down, we call it sawtooth pattern, kind of really unpredictable. Everything keeps getting stagnated, right? It can't decide. The liver is being irritated and it can't decide where it wants to be. Maybe that patient has irregular cycles, like sometimes it's day 28, but sometimes it's 35, sometimes it's day, 42 days. And maybe they aren't ovulating, right, for maybe a couple of months. So the follicular phase is really inconsistent, and you can see that liver qi, again, it's stagnating, it's disrupting that natural rhythm. And on labs, you might see normal or even adequate hormone patterns or hormone levels, but that pattern is off. Maybe that estrogen is rising and then falling and rising again. It's more erratic. You might also see signs of poor nutrient digestion, or malabsorption, poor nutrient breakdown of you'll see low albumin, low protein, signs that that spleen isn't transforming food properly because that liver qi is overacting on the spleen. So clinically, this might be for your patient that has irregular periods, PCOS, anovulation, again, painful periods, PMS, breast tenderness, but benign lumps, abdominal pain, loose stools, irritability, that hypochondriac pain, cold extremities, right? The Cine song kind of classic patterns. And so this is that liver qi stagnation rooted in blood and yin deficiency. That liver just doesn't have enough substance to flow smoothly, so it stagnates. And this regulate basically harmonizes the liver and the spleen. It helps break up the stagnant qi, fortifies that middle jiao, improves digestion, helps that nutrient absorption. And when that liver flows smoothly, right, the spleen works much better. And the follicular phase generally becomes more predictable. So you'll see changes in people where their estrogen is starting to rise more consistently. Ovulation might happen on time. This is again for your really stressed out, overwhelmed patient whose cycle really reflects the chaos in their nervous system. And I love this. It's that liver qi deficiency. We don't talk about that enough because that liver qi is stagnation has been stressing the body so hard, eventually it's deficient, right? And so regulate is great. Again, we're using these for days 14, 4 to 14. Helps smooth out liver qi and really create regularity. All right, this final formula for the follicular phase is energized based on that Leo Junzatong, the six gentleman decoction. This is great for tonifying both qi and blood together with a focus on strengthening the middle jiao. And so again, look at your cycle map. You want to look for signs of kind of just weak signals across the board. Estrogen is rising really sluggishly. The follicular phase is prolonged. It doesn't have enough energy to build that momentum. BBT is staying low, but not because of yin deficiency, but really because there is qi deficiency with dampness, like bogging everything down. And on labs, you might see signs of more poor digestive function, issues with nutrient absorption. So again, maybe you'll see low protein markers, low albumin, low cholesterol. Yes, you can totally have low cholesterol because we need that to make hormones, right? You might see blood sugar dysregulation, signs of insulin resistance here too. That spleen isn't transforming the gu qi properly, low iron levels, low ferritin, but it's not just that they're low, it's literally the body can't absorb and utilize what's being consumed. So your patient presents with fatigue, poor appetite, loose stools, difficulty losing weight, unexplained weight gain, fluid retention, vaginal discharge, joint discomfort. This is qi deficiency with dampness. The spleen, again, can't transform. So everything just feels really heavy and slow. And Energize is great to improve the body's capacity to convert that food into nutrition. And it helps tonify that middle jiao, dries dampness, boosts metabolism, improves digestive function. This is for our patients that maybe have a poor diet, they aren't eating regularly throughout the day, really just generally spleen qi deficient. And when that spleen qi is strong, the body can really actually use the nutrients that they're consuming to build blood, to make hormones, right? To help support that healthy follicular phase. And again, so Energize is days 4 through 14 when that qi deficiency and dampness are the primary pattern. Okay, we're getting into ovulation here. They're represented by the full moon, the season of summer. This is that peak of the cycle, the moment when maximum yang activity and transformation is happening. Hormonally, this is when that LH is surging. It's triggering the release of the mature egg from that follicle. From that TCM perspective, there's so much more happening in that, right? The yang is propelling the uterus to lift, to catch the egg. It's like a cool baseball game. The cervix is opened, but the body is now actively directing energy where it needs to go. The middle dantian is the most active here and strong during this phase. That heart chi needs to be uninhibited because it's directing that entire process. So we want to support again that pericardium to assist with the communication to the liver. Remember that Jue Yin pair here. Really making sure to ensure smooth flow, proper timing here. And that Wei Qi increases, right? Because things are opening, but now we need the release of progesterone right after ovulation to protect the cervix in that during that opening phase. So the body opens, it immediately starts to fortify its defenses. Kidney energy supports both consolidation of yin, the release of yang during that ovulation time. And you need enough yin substance to have created that quality egg for this activity to happen with yang in order for it to be released and release that follicle, turn it into that corpus luteum, right? So ovulation is not just a fertility event, right? We've talked about this. It's a vital health event. And whether your patient is trying to conceive or just, again, simply trying to feel well, having a regular cycle, ovulation matters so much. So this is really the body's primary source of progesterone during this time when it's released. And this helps balance estrogen, it supports mood, supports sleep, protects bone density, regulates the immune system. So a cycle without ovulation is basically a cycle without adequate progesterone. And there's, again, as we've talked about, real consequences long term. So what's interesting, I think, about the Proline formulas, what I really love is there is no dedicated ovulation formula, which is intentional because if you've managed that bleeding phase, you've properly with release, and then you've properly supported the follicular phase, either with enrich, cool, regulate, energize, then ovulation should happen naturally. Excuse me. So the body doesn't need this formula, it doesn't need a formula for ovulation to occur. It needs that strong foundation. That's how ovulation occurs as like a natural consequence of that healthy yin building to smooth that liver chi, right? So again, ovulation isn't something we're trying to force with these herbs. We're really trying to support to create the right conditions. All right, now we move into that luteal phase, the chi phase, represented by the waning moon, the season of autumn. This is that, again, phase of consolidation, warmth, preparation, and a time when the body shifts from building to stabilizing. So after ovulation, that corpus luteum begins to produce progesterone alongside with there's a secondary estrogen peak. This creates like a warming, yang kind of dominant environment. That basal body temperature should be rising, kind of the whole body is shifting metabolically here. Appetite increases, energy turns inward, the nervous system begins to start to naturally wind down. Again, that autumn energy, harvesting what was built, preparing for the next cycle of renewal. So progesterone really matters again, far beyond just reproduction here. It's balancing estrogen, it's calming the nervous system, it's supporting deep sleep, protecting bone density, stabilizing mood, and the immune system. So when the luteal phase is generally shorter, or progesterone is insufficient, we'll see like that downstream effect of like poor sleep, anxiety, mood swings, heavier periods, immune issues, right? Immune dysregulation. So regardless of whether, again, pregnancy is the goal, in TCM, we really want that corpus luteum to activate. It helps activate warmth. It vitalizes our entire system. Our treatment focus here is on lifting chi, stabilizing yang, maintaining warmth, nourishing the environment through the rest of that phase. So as we move into that premenstrual window, that corpus luteum that starts to break down, we don't want hormones to start to plummet, right? There's high demands on the liver and yang qi during this time. And so we need that to support to move blood out efficiently in the next phase to initiate that renewal. But PMS should not be inevitable, right? That's really a signal that the foundation needs support. So liver qi, stagnation, yang deficiency, blood deficiency will really show up loudly here. And so when we support all of those phases up until this point, and now we're supporting those specific patterns, patients will feel so much better. Okay, we're starting with warm. There's three formulas in this phase here. Warm combines that Yogui Wan and the Jingui Shenqi Wan. So this is your like foundational luteal phase formula to support implantation. So when you use warm, you again look at your cycle mapping data. If you're seeing low BBT in the luteal phase, those temperatures like barely rise after ovulation, or they're rising really slowly, that tells you that the kidney yang and jing is deficient. That corpus luteum isn't producing adequate progesterone to create that warmth for holding. So if you are cycle mapping with metabolites, and around 7 days post ovulation, you don't see that nice rise of progesterone. You're seeing really low levels here. This is luteal phase deficiency. So the body ovulated, but the corpus luteum really wasn't built strong enough. It's not functioning optimally. So you might see more of a shortened luteal phase. Excuse me. And it's just not enough time to support implantation, even if fertilization actually occurred. Your blood chemistry, when you're looking at a blood panel, look for signs of poor metabolic function. Again, maybe low cholesterol, signs of hypothyroidism, low free T3, maybe elevated TSH. B vitamins are maybe low. That those all support progesterone production. So clinically, your patients present with um, premenstrual spotting, back pain, slow metabolism, feeling cold, nocturia, edema, loose stools, fatigue, right? The kidney yang and jing deficiency. The body doesn't have enough of that gate of fire, enough fire at the gate of vitality to really warm and activate and support that phase. So warm is great to rekindle that fire. It helps by warming the kidneys, driving out dampness, fortifying the jing. It helps with healthy progesterone production. It vascularizes and stabilizes the uterine lining, helping create, again, an ideal environment for implantation. Or it's ideal preparation for the next menstrual cycle. You're using these formulas now on days 15 until menses. And this is for when you need to tonify that kidney yang to support the holding function. Okay, next we have lift. This is based on Buchang Tong. This is a really good formula, go-to formula for spleen chi prolapse and with mild yang deficiency. So in your cycle mapping, show if it shows like a weak luteal phase, but the pattern is different from warm. So the BBT might rise after ovulation, but it's unstable. It might dip towards mid-luteal phase. There's spotting before their period. The body is struggling to really hold and lift that chi and blood. Progesterone levels at day 21, that 19 to 21 time might be suboptimal. Not quite luteal phase deficiency, but not really robust either. That corpus luteum is functioning, but it's pretty weak. On blood work, you might see signs again of spleen chi deficiency, which would show up with poor nutrient absorption, low total protein. Maybe they have anemia. Excuse me, signs that the body isn't building and holding substance well. And you might actually have your patients, they'll tell you they have rectal, anal, uterine, urinary bladder, or gastric prolapse. Like literally everything is sinking, right? Heavy bleeding, difficult labor, postpartum depression. Everything again is just in this sinking phase. That spleen can't hold things where they belong. So lift is really great at rescuing that sinking chi in that luteal phase and into early pregnancy. So it has a strong chi ascendant quality. It's tonifying the spleen, controlling blood. It warms the yang just enough to support that holding function. And that spleen warming and strengthening action is particularly effective in supporting excess or irregular uterine bleeding when the spleen can't control. And so if you have breakthrough bleeding or spotting heavy periods. So you want to use lift again on days 5 through menses when that primary pattern is spleen chi sinking rather than pure like kidney yang deficiency. This is also a really good formula you can use for early pregnancy support in that first trimester when there's threatened miscarriage or any history of recurring pregnancy loss. Okay, finally, we have our unwind formula based on that modified Jiaowei Xiaoyaosan. This formula is for your premenstrual phase when that liver qi stagnation, stress are those primary issues, right? Excuse me. So use unwind for PMS patterns that luteal phase might be adequate. Progesterone rises, you get a nice little blip of estrogen again at that luteal phase. BBT is fine, but then that late luteal phase, day 22 to 28, symptoms emerge, right? They're getting irritable, breast tender, headaches, digestive discomfort, mood swings. That BBT might show up as it might also show up as irregular, jagged, kind of that sawtooth pattern, and it's not so smooth. And then there's certainly not a smooth decline. It's too fast. So progesterone levels, again, day 21 might be normal, but it's really how the problem is how the body is handling progesterone withdrawal, as that corpus luteum is degrading. So you might see more of a dramatic drop in that cycle map. That liver qi isn't flowing smoothly to metabolize or clear hormones, and you just get stagnated symptoms. And on blood work, you might see liver qi stagnation affecting the spleen, digestive issues, elevated fasting glucose, signs of poor nutrient absorption, and despite if they're really getting adequate intake. So you also might see signs of estrogen dominance patterns earlier in their cycle that have now contributed to those PMS signs and symptoms. And then elevated estrogen, if it's elevated related to progesterone, right? That estrogen dominance. So clinically, your patient is presenting kind of that classical PMS, irregular menstruation, painful periods, stress, headache, irritability, um, breast tenderness, all of that. So this is that spleen qi deficiency, blood deficiency, liver qi deficiency, stagnation. That liver doesn't have enough substance for it to flow smoothly, so it stagnates. So unwind is great to harmonize any imbalance here. It gently regulates and cools the liver. It allows the mind to relax, reduces stress. It supports that, again, that vascularization to the uterine lining. It helps the body prepare for either pregnancy or menstruation. And it's useful for irregular hormone patterns, either throughout the entire cycle, but specifically we're looking for in this luteal phase. And the key here is that unwind doesn't try to like hold or warm. That's what those other formulas are for. It's helping the body transition smoothly from the luteal phase into the next phase, really by harmonizing that liver qi, supporting the liver and spleen, easing that hormonal withdrawal. So again, you're using unwind from days 15 to and on to menses, but particularly focus on that late luteal phase, premenstrual phase, like days 22 to 28, when those symptoms are more predominant. So you might even want to give another formula earlier in the luteal phase, warm or lift, depending on what's going on with the patient, and then switch to unwind. We'll talk all about the complexities and how to use and blend these formulas in part two. Okay, before I wrap up, I just wanted to again talk a little bit about my fall cohort. We're in the middle of the spring cohort right now. It's a great, amazing group. I really have been loving meeting people in this way. And the fall cohort will be starting September 9th of this year. So if anything resonated for you, I'd love to have you join me. It's a 10-week course, functional medicine for your acupuncture practice. You'll learn to run and interpret comprehensive labs, metabolic panels, blood counts, iron, thyroid, advanced hormone panels, like we've talked a little bit about today. And it's all through that Eastern medicine lens. It's 24 CEUs. You get all the templates that I use for my system and what I use in my own practice. And you learn how to really stop referring out these complex, cases. You can start treating them yourself and just have better patient outcomes, increase revenue. Functional medicine really it can integrate seamlessly into your practice. So you can reach out to me or through Five Flavors. And thanks again so much for being here today. I hope you have a strong foundation here of the cycle mapping. We're going to continue on next month for part two.
Thanks, Jessica. Hey, Jessica, do you have time for one question that
Hmm.
somebody raised?
I do.
Do you usually combine cool with another formula? Or are there other specific formulas you always combine with another? if they are too cooling, drying, cloying, etc.?
That is an awesome question, and we will could be covering all of that in part two. So, in order to really get a good answer to that question, I'll show you some of the cycle maps that I've used in my practice and actual case studies, and when you can combine formulas and why you would do that, depending on, again, not everyone's going to have those perfect patterns, and they're certainly not always going to have patterns that are perfect to those that one formula. So you do need to sometimes mix and match there.
Great. Jessica, I really admire how you integrate and weave TCM with functional medicine without running over one or the other. You can hold them as two integral truths that nurture each other as kind of two pillars of understanding. Really reflects your experience and hard work studying. So thanks for sharing with our audience.
Absolutely. I love it. And I think it's such a cool way of looking at blood, right? And looking at hormones and looking at what the inner workings of our body. It's the microcosm. So we can really integrate exactly what we've already learned with TCM, and just utilize that in new ways. So yeah, thank you so much. It's my favorite.
Beautiful. Well, we'll send this out to all the registrants uh,
Cool.
and look forward to part two. And we'll stay in touch.
Okay, sounds great. Thanks so much, Ben, for having me.
Yep. Yeah. Thanks for joining us. All right.
All right, have a good one.